What's up, Kevin?
Hey Tommy, can you hear me?
Yes. Can you hear me?
Yes.
Cool.
Hello.
Hello. Got it. Just the hair is so great.
Thank
Love
you.
it.
Thank you. Welcome everyone. Well, I guess we'll get started, right?
Yeah, 6 o'clock. Let's do it.
Awesome. So once again, thank you everyone for joining us. Thank you, Tommy, for having me in this virtual space with you on this lovely Thursday evening that's not too cold.
Beautiful weather.
Thankfully, right? It's not freezing like this
Last
weekend.
week.
So my name is Kevin, pronouns he, him. I work in the community health department at Whitman-Walker with Tommy, with you.
And hi, everybody. My name is Tommy. I work with Kevin at Whitman-Walker Health. My pronouns are he, him, his. And today we're just giving you guys, everyone, information, whether like Mpox updates.
Yeah, so once again, our regular spiel. During the COVID-19 pandemic, Whitman-Walker's community health department has expanded. We've expanded our outreach efforts to do social media lives, use these virtual spaces to talk to you all about various topics about HIV, STIs, sexual health practices, access to care, social determinants of health, public health interventions. Um,
Kevin, I don't think I can hear you. I got you now. Yeah.
yeah. So as I was mentioning before I cut off, apologies about that. We're talking about different topics. We've been doing a bi-weekly topic about Mpox and providing updates. So let's dive right into it.
Yeah. We're gonna this Instagram live. We're gonna talk about the importance of vaccines. Throughout these last several years, we've had to get vaccine updates, whether it be COVID now, but there have been vaccines prior to that, whether you're here in the U.S. or even traveling outside of the U.S. Vaccines can prevent infectious diseases that once killed or seriously harmed many children, teens, and adults. Without vaccines, your family is at risk for getting seriously sick and suffering pain, disability, or even death, with cases like COVID-19, measles, whooping cough, and flu, and now with Mpox. Vaccines have been pushed in order to help stop the spread and to help us live. Even though some of the vaccine preventable diseases that we protect against are in the U.S., they still occur around the world. And unvaccinated travelers can easily bring these diseases with them in the U.S., putting unvaccinated people of all ages at risk of serious illnesses. So vaccine is not just for yourself, it's for everyone you surround yourself with. So just keep that in mind when you're, worried about getting the vaccine, not sure if you should. Again, it's for you, but as well as everybody else, whether it be your family, friends, relatives, coworkers, everyone's doing their part for each other. And all vaccine preventable diseases are not the same. Some are more deadly than others, and some are more contagious than others. But the chance of getting sick or dying from a particular disease is 1 in 100 or 1 in 1,000. You must decide if the risk is worth taking with your health. No one ever thinks that their child will be the 1 in 10,000 that could potentially die from a vaccine, but nobody wants to be the first. So it's just important just to get vaccinated.
Yeah, and like you mentioned, there's always going to be a risk for everything, right? So unfortunately, there are side effects. We know that when you get a vaccine, a lot of people have been getting it on their arm, and you can get some bruising, you can get discomfort. It's not just gonna be like you get it and that's it. But it's like you mentioned, weighing the pros and the cons, right? And seeing if it's something that you want to do. Something here that you mentioned that I just want to highlight is that when you get the vaccine, not only are you protecting yourself, but protecting others around you. And we know that, folks with other medical conditions, folks who are immunocompromised, um, they exist, they're around us. It's important to think about them, right? And another key important thing we want to mention as well is that you can always consult with your medical provider if you have any questions or concerns. That would be our advice, right? That if you're not sure, that you talk to a medical provider. Just talk to someone about this and have a plan moving forward. And so I wanted to talk about the risks, right? And what are some of the risks associated with getting vaccines, particularly the side effects that are, for the most part, mild. So like I mentioned, redness, pain, swelling, where the shot was given, low-grade fever sometimes in some cases, but all of that goes away within a few days. There are some serious side effects after vaccinations. There can be severe allergic reactions, but in very extreme and rare cases, some healthcare providers are, trained to deal with them. In fact, we just wanted to share a quick stat. A child is 100 times more likely to get struck by lightning than have a severe allergic reaction to a vaccine, right? So when we're talking about risks, there's a risk when we go outside in the real world, when we drive, right? When we're going for a walk in the park. And this statistic is really interesting. 100 times more likely to get struck by a lightning than have a severe allergic reaction to a vaccine. So that's something to consider, or, to have, as context, right? The disease prevention benefits of getting vaccines are much greater, than the possible side effects for almost everyone. The only exception to this are, of course, people who have specific health conditions, someone with a very weak immune system who might be immunocompromised, or if they've had, previous severe allergic reactions to a vaccine dose. So once again, we want to stress the importance of talking to your healthcare provider about this. If you're not sure, getting that consultation. If you're not a patient, Whitman-Walker is accepting new patients. You can call us at 202-745-7000 or email us at appointments@whitman-walker.org and become a patient and get a consultation and get all your vaccine questions answered by a trained medical provider. And so another thing we want to talk about is how vaccines are tested, right? Because I think that's really important. Vaccines are one of the most thoroughly tested medical products available in the US. So we know that before a vaccine can be considered for approval or emergency use authorization, as was the case with COVID vaccines, by the FDA, a vaccine manufacturer must show that it's safe and effective through clinical trials, right? The FDA only licenses vaccines that have strong data that shows that the vaccine's benefits outweigh the potential risks. So, that's something really important to keep in mind. Once the vaccine has been approved by the FDA, there is an advisory committee on immunization practices, ACIP, a group of public health and medical experts who review all the data from the vaccine's clinical trials and other studies, and they basically decide whether or not to recommend, and if recommended, for what ages, right? We saw that certain vaccines are only approved for certain age groups. And once a vaccine has been licensed by the FDA and is recommended for use by the CDC, there are a number of systems in place that work together to help scientists monitor the safety of vaccines and identify any rare side effects that may not have been found in clinical trials. And there's always going to be, outliers and cases that we see on the news, and there's always some sensationalism going around as well, where we hear about it. But once again, there is a risk, but it's always important to talk to a medical provider, get your questions answered, have that consultation if you're not sure, and then you can make the best informed decision about whether or not to get vaccinated. But we know that the best way to prevent Mpox, just like COVID, is through vaccination.
Yeah. And like a question that we, get asked often, like, is it dangerous for children to get so many vaccines when they are young? The answer is no, it's not dangerous. The vaccines in the CDC's recommended childhood immunization schedule are carefully timed to provide protection to your child when he or she most vulnerable to the disease, and when the vaccine will produce the strongest response for your child's immune system. So again, it's not dangerous for your child to get vaccinated. It's encouraged because they carefully monitor this and make sure that individuals from different age ranges can get the vaccine. And if a certain age range is not capable of getting the vaccine, then you'll definitely be aware of it. They'll make it known. And then another question, is natural immunity better than vaccines? People can just be like, well, I can just take a certain multivitamin, or I just drink more water, or if I work out harder. It is true that natural immunity usually results in better immunity than vaccination, but the risks you're taking with your family's health are much greater. You never know how the disease will affect you or someone you love in your family. Like, look at how COVID hit. People from all age range and groups, whether you're super fit, super old, super young, people were still getting sick. There were deaths that were occurring between all age ranges. So again, it's a risk, and when it comes to COVID-19 vaccine, studies have shown that getting a COVID-19 vaccination is safer and more dependable way to build immunity to COVID-19 than getting sick with COVID-19, as well as Mpox. And according to the CDC, the immune system is not fully developed at birth, which puts newborns at greater risks for infections. Even though the baby may get some short-term immunity from the mother during the last few weeks of pregnancy, it is only for the disease in which the mother is immune to or vaccinated against. So if the mother is not vaccinated or doesn't have immunity to the disease that's out right now, then the baby will not have the protection for the duration of the pregnancy. Even breastfed babies need to be protected with vaccines, of course, at recommended ages. And, of course, while breast milk provides important protection from some infections, such as the common colds, ear infections, and diarrhea, as your baby's immune system is developing, breast milk does not protect children against all diseases. Your baby needs the long-term protection that can only come from making sure he or she receives all the vaccines.
Yeah, so really important, once again, vaccinations, right? Getting those vaccines at the appropriate age ranges. Once again, talking to your medical provider about guidance and getting clarity, having your questions answered if you're concerned about side effects. Really important. So now we wanted to really quickly segue into ways you can stay to protect yourself from Mpox. Once again, these are suggestions. So we're not necessarily telling you what to do, but these are some tools in our toolbox to stay safe and stop the spread of viruses. So continuing to wash your hands. We've been doing that during COVID, during the pandemic. It became routine to just make sure we're washing our hands, wiping surfaces of frequent use like doorknobs, door handles, all that good stuff. And if you're going to be sexually active, using condoms, practicing safe sex, using face masks when you go outside, especially in indoor settings, where there's a lot of people, talking to your partners about their sexual history and status, getting yourself regularly checked with your local healthcare provider or local wellness clinics like us at Whitman-Walker. So once again, a quick spill. Whitman-Walker is still doing HIV and STI testing. We're doing that Monday through Friday from 9 to 4. So if you're interested, you can call us at 202-797-4439 to schedule an appointment to come in to get tested for HIV and STIs. And if you feel that you have Mpox or you've been in close contact with someone who tested positive for Mpox, go get tested, talk to your medical provider, make an appointment, continue to wear your mask in public spaces, continue to wash your bed sheets. I feel like we mention this all the time, but especially if you're sexually active and having multiple sexual partners, you want to make sure you wash your bed sheets in between sexual partners. Continue to washing your hands and practicing hygiene. And of course, you can, one of the things that we mentioned previously was how a lot of these symptoms can appear to be flu-like. So people will experience fever, sore throats, almost like if you were getting a cold or a flu. So what we know about COVID and the pandemic is, self-isolation, right? Just limiting the exposure or exposing others to this virus. So yeah, those are some risk reduction strategies we wanted to share with you. Very straightforward.
Yeah.
and continue to talk to your partners. And if you see anything unusual in their skin, or if you notice anything unusual in your skin, talk to your healthcare provider. If you don't have a healthcare provider, once again, Whitman-Walker is accepting new patients, so feel free to reach out.
Yeah. And just if nobody was aware, as of October 15, DC has 3 Mpox clinics that merge with the COVID centers in wards 2, 3, and 8. So you can get your vaccinations, whether it be your first dose or your second dose. You can get them at anywhere between ward 2, 3, or 8. The address for ward 2 is 926 F Street Northwest. Ward 3's location is 5335 Wisconsin Avenue Northwest, and Ward 8 is 3640 Martin Luther King Jr. Avenue Southeast. And you can find all these locations and information on the DC Health website. They're pretty much open between like 10 and 8, Monday through Friday, with certain days being closed for each location. But again, you can check out the DC Health website and get more information on that. But again, you can get either your first dose or your second dose of the vaccination for Mpox. And I'm sure COVID, you can also get your vaccination there as well. If not, you can also get them at CVS, Walgreens, Whitman-Walker, many locations that you can get your vaccines at.
Definitely. And another thing that I like to add, Tommy, is that, of course, if you are a Maryland resident, but you work in DC, you go to school in DC, or you receive services from clinics like ours or from any programs in DC, you're also eligible to get vaccinated in DC for Mpox. You can check out the eligibility criteria at the Mpox website of DC DOH or DC Health. Maryland and Virginia also offer vaccines now. Vaccine access has gotten so much better, which is amazing given where we were at the beginning. So, go get yourself vaccinated. And if you have any questions, any concerns about side effects, reach out to your medical provider, schedule an appointment, talk to them about any concerns you may have about side effects. And yes, there are risks, but the benefits outweigh the risks.
Yeah. And as always, everyone just continue doing your part, whether it be getting vaccinated, continuously washing your sheets, or just keeping yourself, your sexual partners, family, friends, all safe. Yeah. That's pretty much all that we have to talk about today during this Mpox Live update. Again, if you have any questions at all, you can also reach out to me or Kevin or Whitman-Walker or your primary care physician, and we'll be happy to direct you to get you the answers that you're looking for.
Yeah. So thank you, everyone, and Happy New Year.
Happy New Year, everybody. See you in the next year.
Bye-bye.
Bye.